Physiotherapy is an organized scientific profession. So the entire activities during the practice of physiotherapy should be in a very organized manner. When we look at the activities happening during the course of treatment, there are different elements. So each and every element, when you look and see the activities in each element, the events happening in each element should be in a very organized manner, both the therapeutic and non-therapeutic. Next thing what you need to see is that all the organized industries, including healthcare industries, are now following lean management principles. So physiotherapy profession should come up to that level and utilize the principles of lean management for the betterment of the physiotherapy business as well as the quality of service. So both the sales as well as the quality of service can be improved with the application of lean management principles in the process of physiotherapy. The lean management can be defined as a way of managing the workflow or the process during a course of treatment by eliminating or minimizing the waste. So the concept of lean management is either elimination or minimizing the waste. Now when we see what is waste, there are seven in management studies and all, we can see that there are seven potential waste and all. But when we consider physiotherapy, physiotherapy in the entire value chain of the process of the workflow or maybe the entire course of treatment, in that there will be, in this entire value chain, one patient comes in and finally goes out by curing a particular condition. In this entire process there will be value added and non value added services. For example, one value added service can be said as administering an ultrasound therapy to a particular region of the body. Non value added services may be carrying the machine from one particular electrotherapy room to another electrotherapy room. This kind of service is not actually having any value, but sometimes it may be inevitable. Without bringing the machine to the place where the patient is, you cannot deliver the treatment. So there will be both value added and non value added services in this entire workflow. So how you can deal with minimizing or eliminating waste. So sometimes waste may be intellectual waste. Sometimes it will be like the patient may not be bothering about the extra service that you are giving. That also can be considered as a waste. That is why this the micro-analysis and macro-analysis, means the analysis of your target customers, are very important before setting any strategy or the operational strategy. It is very important to study your the kind of patients that you are going to expect in that particular center is very important. Likewise only the strategy should be constructed. Likewise only the strategy should be planned. Otherwise it will result in lot of waste. So these kind of analysis and studies are very important in eliminating the waste. So this is the concept of lean thinking or lean management. Now we will look at an example of lean management in the electrotherapy process. The scenario is, in your particular center, you are a physiotherapist, in your particular center you are not having hydrocollateral pack unit and you need it desperately. So you want to show to the management or to your investor that this particular machine needs to be there in adding the value to your services, maybe in terms of sales or maybe in terms of the quality of the treatment. So how you can do it, that is what we are going to see. So we need to look into two particular scenarios. One is the sale. Always the financial aspect is very very important. For that you need to show how many units you will be the units that will be sold. Second scenario is the quality of treatment. The quality of treatment is not only important for the profession but also for the sales to go on, because the in all the medical professions, especially in a country like India, more than advertisement, mouth to mouth advertising works. So one patient goes out and tell a negative opinion about your center, that will affect very badly. That is why now all the hospitals and all started using the business model of balanced scorecard. That's a very new operational method, operational strategy model with which many hospitals are following, because the feedback of the patient, the updation in the process, everything are equally important, not just minimizing the expenses and increasing the income. That is not just what matters. So, when we consider, we need to consider both the unit being sold uh, and the quality of the service. For that, we are going to see now. We will see one table and a graphical representation of a table for showing how many units can be sold. For example, how many units of hydrocollateral therapy pack sessions can be sold. Here when we say session, or when you want to map it, or when you want to, if you want to project it, there should be specific units. It should be quantifiable. So here we are keeping one session as 5 minutes application of that particular therapy unit. In this table, we can name it as the utility mapping, electrotherapy utility mapping. You can see that many electrotherapy equipments are being listed and how many sessions are being delivered to particular patients. And we are considering here the usage of this much of electrotherapy units for a particular condition called periarthritis of shoulder joint. So here in this for treating periarthritis of shoulder joint which comes to your clinic, this much of electrotherapy machines are being used. So if you look at the negative score which you can see in the hydrocollateral pack sessions, you have to understand that this much unit which has to be sold is not being sold because of non-availability of that machine. So this much units you could have sold to the patient for increasing the income of the clinic. So now same thing we are going to project it into a graph. So using now you can see the bar graphs. So in this why this bar graph is necessary? Why this data table mapping is not sufficient? The answer is always it is good to show a picture rather than giving some figures. For example, explain how, when you explain about elephant to a particular person, you can say that wild animal having this kind of dimension and with this much mass. So that can also be done. Better than that, if you show the picture of the elephant, it will be more clear for that particular person. Just like that, graphs always gives more visual impact, and it is always better for analyzing the situation. So this same data table map is being projected as graph. So here visually you can see that this number of hydrocollateral pack we could not use this much units could not be sold because of the non-availability of that machine. So next thing what you need to look here is that if you see there is something, there is a gradual increase in some particular machine. Here you can see that the IFT and the vibrator machine is usage is gradually increasing. So that means that you need some more units, some more some more interferential therapy unit and some more vibrator unit. So otherwise, so this also should be this particular scenario also should be considered along with the financial aspect. Financial aspect means you may be knowing about the depreciation of one electro per year depreciation. This all together should be calculated. So financial aspect also should be considered along with this. If you invest for this particular machine, whether you are going to get back, see, all these scenarios should be cross examined. Now next thing, so this is about the sales part or the usage part, utility part. Now when we see how it is going to affect the process, how it is going to affect the quality of treatment, that also we can very easily project using the data table mapping and the bar graphs. So that is what we are going to see now. So in this we are putting certain criterias. So criterias, we are putting 5 different criterias, which are 5 different objectives when we are treating a periarthritis shoulder joint patient. We are keeping ROM as one criteria, range of movement as one criteria will be activities of daily living, one criteria will be reducing pain, and we are keeping 5 different parameters. Whether, okay, one is the satisfaction level of the patient, another one is what is the percentage of recovery, then whether you are able to use all the appropriate machine which was required, and whether the patient has completed the session. And these all, based on these all parameters, 5 criteria which are the objectives of this particular treatment is analyzed. So here in this electrotherapy process graph, if you see, we have kept 5 different criteria. One is pain, reducing pain, reducing joint adhesion, then reducing range of movement, then muscle function, then improve activities of daily living. And for analyzing, we are keeping 5 different parameters. One is satisfaction level, achieved recovery compared to the expected recovery, preferred modality application, and the sessions completed. So these are the 5 different parameters. Based on this, we are going to do the analysis. So when we look at here, the basis of analysis are the 5 different objectives of this particular condition. So here you can see that in this joint adhesion, reduction of joint adhesion and increasing range of movement, the expected modality percentage is only 50%, means only 50% of the modality which was supposed to be used was only used. But when you see the satisfaction level or the expected recovery level, you can see that has not only affected the joint adhesion and range of movement, but also the pain. So this is how the treatments are interrelated. So this, what happens here is, because of the non-usage of a particular electrotherapy modality in this value chain, that is going to destroy or eliminate or the value of something which was supposed to give value. So this is the result of this analysis. By this you will be able to understand better, and you will be able to convince yourself as others why this modality was this much important in giving a efficient treatment for periarthritis shoulder, as well as improving the sales of the particular organization or in this particular process.